This is Aunt Josie, a mother, a sister, an aunt, a beloved family member who was recently diagnosed with terminal cancer and wasn't given long left to live. Her death is going to be painful and potentially very messy. However, there is one option that she could still potentially explore, and that is physician assisted suicide. Since I was 17 and I joined the military as a medic, my professional life has been centered around medicine. And as such, I have experienced many different forms of death. One of the most common worries when facing this traumatic issue is the memory of their passing. Deathwithdignity.org is a government funded website that gives those interested a way to begin the journey, a way to find more options, a way to see what's available to them, or simply a way to see what stories other people have shared, such as the story of Shamika Linson, who shares the story of her grandmother's passing and the painful memory that she still retains. I believe there is a certain group of qualified, terminally ill candidates who can preserve the memory of their passing in the last moments of their life in a dignified, wholesome manner. This can prevent anxiety when it comes to dealing with death for both the patient and the family. It gives the patient, or the person, the sister, a more peaceful passing and gives the family a much more pleasant memory, a much more pleasant thought when they hear her name again or his name again. Today I'm going to talk about physician assisted suicide and what I believe to be the benefits for not only the patient involved, but the family as a whole while facing one of the hardest scenarios imaginable. First, in order to understand the program, let's take a look at the origin and the roots of it. The first law was established in 1996 in Australia, and they named it the Rights of the Terminally Ill Act. Shortly thereafter, Denmark was the second country to follow, legalizing both euthanasia and physician assisted suicide. Euthanasia is a lethal dose of medication given to a patient inside of a medical facility by somebody other than the receiving patient. This means a doctor or a nurse or somebody a part of the medical team gives the patient the lethal dose. They do not administer it themselves. This is illegal in every state in our country. On October 27th, 1997, Oregon was the first state in the United States of America to legalize physician assisted suicide. Currently, today, there are 5 states that allow this program, and that is Vermont, Colorado, Oregon, Washington, and California. The legal process is currently over 20 years in the making. However, I understand that that doesn't mean a whole lot to everybody listening right now. So let's take a look at the process a little bit more so we can get a better understanding of what exactly it is we're talking about. First, there are several legal requirements that somebody must meet in order to even begin this journey. First and foremost, which I truly believe to be the most important portion of this, is the patient must seek this treatment on their own. This cannot be brought to them by a doctor. They cannot be referred to this program by anybody. The patient must do the research, get the paperwork, and take it to their physician to even start this. Once they do that, the second big part of this is the administration of the medications must be done at home and it must be self-administered. In no way, shape, and or form can anybody else assist the patient in the ingestion of these medications. The third big part of this is the prescribing physician must receive approval by at least one other equally qualified and specialized medical doctor. In each state currently there is actually a board of physicians who specialize specifically in this, and each one of them uses the entire board before they can continue with the process. It's filled with a list of both checks and balances which minimize potential abuse and any possible errors. The cocktail that is given to the patient is discussed, planned, and altered to the patient's needs with each individual person. This isn't just one set thing that everybody gets. The doctor and the patient both sit down and discuss and come up with the best possible solution for this patient. In theory, this does sound all good. The system sounds wonderful. It sounds perfect. However, I'm sure there's a number of people listening that are curious as if the application of this system is nearly as clean as it sounds. A group of over 50 doctors closely monitored the first year of Oregon's legal practice in 1997. And they wrote an article in the New England Journal of Medicine about the results that they found. A total of 23 patients were prescribed the lethal dose of medications and took it home. 15 of the patients took the medication. All 15 patients died shortly after ingesting the medications exactly as planned, with little to no struggle or side effects evident by the fans reported by the families. Every dose that is prescribed, even still today, is continuously and closely monitored, and a close relationship is kept by both the medical team involved and the board of physicians. Now, I understand this is a heavy topic, I do, and so far I've only talked about legality issues, but what still remains is the biggest question, I believe, and that is why? Why? I spoke earlier about Shamika Linson, whose granddaughter shared her last memory. Shamika died a few years shy of her 60th birthday after a long battle with lung cancer that left her with internal bleeding. Barely alive and vomiting blood over both herself and her granddaughter, that she was rushed into surgery, where she died shortly after from blood loss. The doctors could not find the bleed, nor could they replace the blood fast enough. The idea of this program is not to condone death or to find an easy way out. It is to preserve the last memories of that person and to minimize any potential suffering. Physician assisted suicide is a program that can have tremendous benefits to those who are both interested and qualified. Stories such as Shamika happen every single day. As a matter of fact, someone is going through this right now as I'm giving this speech. Some of you may have experienced something similar in your past, and if you have my deepest condolences. This is not for everybody, nor should it be, and that is 100% completely okay. However, what I am asking is not for you to support the program. I'm not asking you for anything like that. What I'm asking is for you to support the people that do desire to have something like this available to them. I'm asking you to not take this right away from somebody who is interested, those who do desire to die with dignity. Thank you.